Hello, everyone, and welcome to the show. This is Evidence in the Green, Closing the Cannabis Research Gap. I'm your co host, Lakeisha Moulton,
And I'm your other co-host, Arnell Etienne.
and in this 5 episode podcast, we'll sit down with some of the cannabis industry's leading professionals, each a subject matter expert in their own respective fields.
Over the course of this 5-episode series, we will cover topics like federal and state regulations, optimal study design, how cannabis research can translate into changes in public policy, and much more. We hope you enjoy the show. The Society of Cannabis Clinicians Medical Cannabis Conference is in Denver, Colorado this year. For 15% off of registration, use our code CP15.
Thank you so much for having me. It is such a pleasure to be invited on the show today. I cannot wait to talk about this topic.
We're so excited to have you here. Thank you for being here. One of the reasons why we wanted to have you as a guest is because you have opened up our minds to a variety of topics. One being the interplay between cannabis research and how, when it's not properly presented to the public, how we can have gaps in understanding and gaps in application. And also, one thing I really enjoyed is having you as a professor, explaining how to make science and research more accessible to uh, patients and lay people, as they sometimes call them. But I think you called it practicing, non-practicing scientists, which I love that verbiage. So we're so excited to have you and to just talk about these different topics. So one of the first things I wanted to ask you is, how does your background as a board certified pharmacotherapy specialist and board certified psychiatric pharmacist influence the way that you approach cannabis research and analysis?
Yes. As a board certified practitioner, I've been trained in the practice of evidence based medicine. So, evidence based medicine is something where that all healthcare practitioners practice, well, Western trained healthcare practitioners, where it all starts with the patient in mind. So, you have the patient, you evaluate the evidence, you look at what the patient's preferences or values are, and you combine all that to figure out kind of how you're going to move forward with your treatment plans. So, when I look at cannabis, I approach it the same way. I look at who is the patient in front of me, what do they want, what do they desire, what are their treatment goals, and then I look at the available evidence as a starting point to start to try to craft therapies that are going to be very specific for that one individual.
With that being said, since cannabis is so new in the grand scheme of things and in our current state, what oversights have you been seeing in research studies versus patient application, or even clinical application, clinician application?
Yeah, this is a really great question. I am a psychiatric practitioner where things are already very gray. We have a small amount of research that we use for clinical practice because it's typically not prioritized over something like cardiac research, which is about the heart. Um, so already I'm used to working with smaller sizes of research. With cannabis, I feel like it's kind of a natural progression where I start with the research, but I realize that there is just kind of a lack of it. There's not as much as we would need. And there are various reasons for that, which I can go into, but it does provide us some starting place. And I believe that if cannabis is going to be seen as medicine, which we know it is, but we live in America where people do also primarily practice a westernized model of care. And not saying that that is the right way, because there are plenty of ways to do care, but um, just how can we combine this special plant medicine that needs to be treated as such with Western medicine and have it in a way where we can now incorporate it into Western medical systems.
So you mentioned that there's already a lack of research in your field, as opposed to other areas of specialty. And so, with that being said, what oversights do you see in cannabis research studies versus patient application within the context of your specialty?
Yeah, so I work in psychiatric pharmacy. So, psychiatry is going to be the study of the mind. And my job is all about what types of medications and other non pharm things can we use to help someone heal their mind. So, just in general, psychiatric research doesn't tend to be as robust as some areas. For instance, cardiology, that's the heart. A lot of people in America have heart problems. Therefore, a lot of money is kind of funneled into that area. Mental health doesn't get as much just big funds coming in. So we kind of see something a little similar with cannabis, where cannabis, most research is already taking effect under the guise of, not the guise, but under the National Institute of Drug Abuse. So it's more focused on harms in general, and not as much is focused on mental health. But that could change, because one of the big reasons that people go to use cannabis besides chronic pain are psychiatric issues like anxiety and insomnia. So I'm hopeful that there will be more research in those areas, but for now it is kind of difficult to locate well done randomized control trials about cannabis research for mental health conditions. But stuff's still coming out.
Can you explain why it's hard to get those types of controlled trial research studies created and also published?
Yeah, so a randomized control trial is what we as scientists consider one of the gold standards of study design. In a randomized control trial, what you have is you have a group of people that have been mixed up on a whole bunch of different characteristics. So, race, sex, other illnesses that they might have. So, it's distributed throughout the population. So, you can divide them into different groups. Then you introduce an intervention. So, in our case, that would be cannabis. And then you have a group that doesn't get that intervention. So, a control group, or they get another intervention that's typically given. And then researchers, what they would do is they would have some results that they wanted, and they would give people cannabis in one group, they would measure the results, and then they would give people the other control or whatever standard of care they were getting, and they would measure those results. And you would want to see a difference between the two, to say, okay, cannabis is likely causing this effect. So it's harder to get those kind of studies funded for cannabis research. There's just less of those studies going on. If someone wants to do research with cannabis right now, for a long time, you could only get cannabis from the University of Mississippi. And that cannabis did not really mirror what is out in communities. It was not as potent. It had a lot of stems in it. It had a lot of seeds in it. And that's just not the reality of what's on the outside. So already when you're conducting research on something that's not as real life, then that is going to lead to skewed results. Also, with cannabis, for researchers to even be able to get it, they have to register. They have to go through all these regulatory hurdles to even have cannabis, because it's still a Schedule One controlled substance, which means that the government considers it highly addictive and having no medical value. So there's just a ton of hoops to jump through. It's also really hard to um, blind people to the fact that they're receiving cannabis, because for people who are in that intervention group, they can usually tell they're getting cannabis because of the way it smells or the way that it makes them feel, versus if they didn't have cannabis or they had something that was supposed to kind of behave like cannabis. So, all these things are reasons why it's harder to conduct cannabis research. It's not that it can't be done, but for a randomized control trial, it's hard. Also, when we're conducting cannabis research, we have to make sure that the way that we design the trials isn't going to potentiate harm. We want to make sure that patients are as safe as possible during a research study. So, for instance, when researchers are studying something like cannabis and psychosis, which is a hot topic, definitely something that we should keep on our radar. Psychosis is what I actually specialize in, and that is when people are seeing, hearing, experiencing other sensations that other people are not experiencing. And so, with that, we know that there is an increased risk of psychosis, so an increased chance that it could happen in certain people, particularly if they are younger, if they're using high potency THC products every day, and they have a genetic predisposition for that. So that means that maybe their mom or dad had a history of schizophrenia or bipolar disorder where they were experiencing psychotic symptoms. So, for those patients, if we're designing a trial and we want to see if THC causes psychosis, it's going to be very difficult because no one is going to approve that trial. Because if you give people who are already at an increased chance of of psychosis, high potency THC, then it could lead to some poor outcomes. So there are other ways that we kind of design trials too, besides randomized control trials, to look at effects of cannabis like that as well.
And what are some of those ways?
Yeah, so one thing that I think might be very helpful for cannabis research, because there are all these limitations where we the cannabis that we're getting to study isn't necessarily reflective of what is in the population. And if you want to study something where it's a little more difficult to study in, like patients who are at a higher risk for psychosis, or patients who are pregnant, and you want to kind of see what risk we have with cannabis, you can design observational studies. So, with an observational study, like a cohort study, that's one with the highest level of evidence, or a case control study, what you're going to have is a researcher who is going to watch a group who is already exposed to cannabis, and then kind of see what the outcomes are. So that is a little bit safer because you're not just directly giving someone um, cannabis when there is an increased risk of harm there for those specific populations. I think that cohort studies are a type of study that we can use just to kind of get around some of the difficulties that we have getting cannabis from sources in randomized control trials where we know it's reflective of the community, because you can just kind of observe what's going on in the community. Now, you would have to design that trial in a way where you're kind of certain what people are getting, and that they're able to report that and report it honestly and talk about their usage, because if not, then that is really going to affect the outcomes of the study. But that is still a good place to look to data. It can't necessarily tell you a cause and effect relationship, but it can tell you how variables are associated. So those could be pretty powerful. So I've seen some of those designed pretty well to look at cannabis and depression, or cannabis, mostly depression and mood type things, where they're more longitudinal studies and researchers are looking for outcomes over time.
Yeah. And I think it sounds to me like that's even easier to do in a legal state, because in terms of reporting for a patient, I can show you, what the little package says, and you can get data like what are the terpenes and what are the cannabinoids. So that's really interesting to hear those different types of ways of getting that information in still a clinical sense. So I think I have a
Yeah.
question for you. Um, I wanted to know, how can researchers make their findings more accessible to the public, and how can they reach dispensaries and even providers in a more effective way? Because there's this kind of gap between what patients think and what dispensaries are kind of touting as like the best quality, cannabis, but there's this what trend that we're seeing in research that's saying a different story. So how can we get that message between these groups?
There are definitely a lot of kind of gaps in how scientific messages are communicated. With cannabis, I think one of the additional challenges is that it's not very clear cut. So it makes it hard to do messaging when you say something like, oh, this could be beneficial for you, but it also couldn't be if this, and this are things, because people have a hard time sometimes dealing with that just gray area. So what when I'm communicating with people, what I like to let them know is that the literature is still very limited when it comes to cannabis for the treatment of different mental health disorders, but that doesn't mean it's growing. A lot of people might report that cannabis is helpful for something like anxiety, but we don't have necessarily a ton of hard data to back that up. So we can start with what we see, which if someone wants to come to me and they want to use cannabis for anxiety, I would show them some studies and be like, see, look, we haven't really studied cannabis in the type of anxiety disorder that you have. But this is how, if you wanted to use cannabis based on this, how you could use it safely. So, a lot of the education that I do around cannabis and that I encourage other people who are health educators are to focus on what can people do to reduce the amount of harm from cannabis and how can they monitor cannabis to make sure that they're using it safely as opposed to getting people all involved in the nitty-gritty of the literature, because literature analysis, as much as I would want everyone to just be able to read a scientific paper and understand it. There's still a lot of terms to break down in there. You probably need to go through it with someone who understands a little bit more of what the statistical tests are saying, how the study is designed. Um, but I think just really harping on like the what can we do to prevent harm. So, for instance, someone just had messaged me the other day about a paper that had come out in Canada, and people were very concerned because it looked like in their emergency rooms they were seeing a higher proportion of people who were coming in with um, who were using cannabis who were coming in with diagnoses of psychosis. There's a lot that goes into that. It's hard to diagnose someone with schizophrenia the first time you see them. This is a long disease. So when I look at that, I'm like, what is the diagnostic criteria? There's a lot of variability in how different people say things are schizophrenia because within mental health, things aren't necessarily clear cut. So there are just a lot of questions that go on with that. And when I see that data come out, I don't necessarily think, oh, this is just a huge problem, because I would need to know more about what was going on in the study and think about more of the limitations. Utilize combinations with less less THC. That's fine. Or utilize combinations that have more CBD, because that might have an antipsychotic effect. So instead of getting so caught up in the inflammatory headlines, it's important to stop and defer to scientists, people who know how to interpret this information, really look through the bias on it, and then figure out how to communicate to the public about just how to safely use cannabis. Once we have more information about efficacy data, which is how well it works, then I feel like we can start communicating more of that. But right now, I think we're still more in safety harm reduction phase.
Mhm. That's really important to distinguish between, because I think sometimes we want all the answers right now. And I think in the frameworks that we have to understand the steps that it takes to get to a point. And that seems to be a theme that's just common in cannabis in general. So thank you for answering my questions. I appreciate your time.
My pleasure. It's so nice to be here today.
Well, everyone, that concludes our show for today. We hope you've enjoyed the content. I'm your co host, Lakeisha Moulton, and we will see you guys next time. Feel free to check out the show notes and the resource links.